Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hi, I'm Dr. Nilesh Nadkarni. I'm neurologist practicing in Chinchwad, Pune.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, our brain has got electrical activity which is present even when we are sleeping, and the electrical activity goes on very smoothly. Now, what happens during a seizure is rather than a smooth and a small amplitude electrical activity, there is high amplitude and a high frequency electrical discharge in the brain. Okay, so a seizure is nothing but a high amplitude and high frequency electrical discharge in the brain, and then these currents can flow into the muscles and can lead to a seizure.
Okay, doctor. And what is epilepsy, sir?
Epilepsy means uh, if a person is prone to get recurrent seizures, then you call it as epilepsy. So seizure, a single episode can be called a seizure, but a person may not get a seizure in the entire lifetime again. So 70% patients who have seizure may not seize in entire lifetime. But if they get a second episode of seizure, then you say that, oh, this person is more likely to get more seizures in future. So this is epilepsy. Or suppose some patient has a seizure and then you do imaging of the brain and you find that there is some tumor or there is hemorrhage, and you know that this person is going to get seizure again in life, then even if there is a single episode of seizure, you will still call that he is prone for epilepsy.
What are the different types of seizures and do they affect people differently?
Seizures are of different types. The classical type of which we all are aware of is generalized tonic-clonic seizures. Now, usually these seizures are portrayed in even films where you can find that the person who has a generalized tonic-clonic seizure has uprolling of the eyes, clenching teeth, the limbs become tight, and then there is to and fro limb movement. Okay,
Okay, okay.
usually it lasts for say 2 to 3 minutes, and then the person becomes unconscious. Okay, so the commonest seizure that we come across is generalized tonic-clonic seizure. But other than that, there can be partial seizures where the seizure discharges are not generalized all over the brain. It may be only a part of the brain, and hence a partial seizure may be involving only a part of the body, only say one side hand and leg, only the eyes are moving around, only the mouth is twitching. Okay, now that is called as partial seizure. Now, if in partial seizure, if the person loses awareness, then we call it complex partial seizure. If he is aware of the event, then we call it simple partial seizure.
Okay,
Other
thank you,
than that,
doctor.
we have absent seizures where the person is just unaware. Okay, so
Okay,
while
doctor.
talking, the person just loses awareness. You feel that this person is daydreaming, and it can last for few seconds to minutes. There can be another type of seizure, what we call as myoclonic jerks. So in myoclonic jerk, there can be a jerky movement of the limb and things may just fall off from their hands. Okay, it lasts for a
Okay.
fraction of a second and awareness may be retained during the episode. So even though the general population is aware of only generalized tonic-clonic seizures, okay, there are other types of seizures too.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
See, epilepsy can occur due to different causes. Now, how do we divide that? If in epilepsy, the primary pathology may be in the brain, or primary pathology may be in the blood, and brain is secondarily affected, or the primary pathology is neither in brain nor in blood, it may be in mind, means stress. Okay. Now, suppose somebody gets a seizure, then we do need neuroimaging of the brain, because we know that seizure can be a manifestation of brain tumor, brain hemorrhage, decrease in blood circulation to brain. Okay, but other than that, we have to do all the blood tests, because there can be seizure due to low sodium in the body, low calcium, even a patient with liver dysfunction or a patient with kidney dysfunction can present with seizure. Okay, so it's not that if a person has a seizure, that means all the pathology is in the brain. It's not like that. If there is a primary pathology in the blood, then brain can be secondarily infected, because we have got only one body. So any pathology outside the brain but inside the body can secondarily affect brain and cause a person to have a seizure. Okay, but other than that, one of the other common thing that we come across person who has seizure is mental stress. So stress can also give rise to seizure.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
See, if you look into the origin of word seizure, what it means is the person is being seized by devil. Okay, so from that word came seizure. Okay, so it was thought earlier that during a seizure, the person is not aware, so he is being seized. He is being seized by devil. So a person is unaware, he may fall, he may fracture himself, there may be tongue bite, there may be stool or urinary incontinence. So, and the person who actually looks at the seizure may develop anxiety as to what is going on. Okay, suppose you find somebody having seizure where there is clenching teeth, falling from mouth, eyes are uprolled, and then limbs are shaking. Okay, so even that will be bring anxiety into the person who is looking at it. Because of that, there is definite stigma. The commonest thing that we find is employment problem. So suppose somebody has a seizure and he declares that, then what the company will think, oh, should I really be employing him? What if he gets a seizure in this company and he injures himself? It can be problem for the company. Okay, so they get employment problem. Another thing is usually ladies who suffer from epilepsy, they find trouble in marriage prospects, because uh, the prospective groom or his family may think that what if the child may inherit this seizure from the patient, or what if there may be seizure while the person is cooking food in kitchen. Okay, or what about the side effect of medicine? So definitely stigma is there.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
See, to all those patients who have a single episode of seizure, I tell them that you need to take certain precautions for your entire life. Okay, try to avoid stress. Okay, mental stress is known to precipitate seizures. Okay, like I will give you example. There was a person who sat in aeroplane for the first time, and he developed so much anxiety as the aeroplane started to run on the runway that he had a seizure in the plane. Okay, then I have got 3 4 patients who had death of their close relative, and then it was so much depressing for them that they had a seizure. So lot of stress, depression, okay, can lead to seizure. Lack of sleep can also precipitate seizure. So all those patients who have had a seizure should pay proper attention to their sleep. I will give you one example. There was a young person who went to Goa from Pune, but the only mistake he did was he was driving his car at night. He did not sleep the entire night, and the next day when he reached some hotel in Goa, he had a seizure. Okay, so
Okay.
all the patients who have seizure should pay proper attention to sleep, avoid mental stress, should eat their food on time. Okay, because if the sugar levels go down, even that can precipitate seizure. They should not enter into any water body alone for swimming, because if there is a seizure in any water body, then the chance of drowning is very high. Okay, they should not go near large machines. Okay, because if they get a seizure near a large machine and they fall down, if their hand gets entangled into the machine, then there can be amputation. Okay, I tell ladies who are suffering from epilepsy that if they switch the gas on for cooking, then after they have done that activity, they should get away from the stove. Okay, many years back, one of my patients had a seizure while she was in kitchen and she fell on the burning flame and her sari caught fire. Fortunately, she was saved, but this precaution will have to be taken. Okay, then I tell the ladies that once they have finished with chopping vegetables or fruits, they have to keep sharp objects away from them. Okay.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
See, I think Arcane is doing well. Arcane produces good anti-convergents and at an affordable rate. Uh, I have my best wishes for the company.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.